Okay, good morning, everyone. We are going to get started. Thank you for joining us today. My name is Stephen Gitsoyan. I'm the Assistant Director of Alumni and Family Relations at Cal Lutheran. On behalf of the Alumni and Family Relations team, I want to welcome you to our webinar this morning. Just a few housekeeping items that I want to go over before we get started. If you have any questions during the presentation, please use the chat box located in the Zoom menu. We will have dedicated time at the end of the presentation for Q&A. When you joined the meeting, your video was off and your microphone was muted. There's no need to change these settings during the presentation to help us avoid any excess noise or disruptions. Finally, this presentation is being recorded and it will be posted on our website for you to reference later this afternoon. Now, it is my pleasure to introduce our presenter for this morning. Dr. Paloma Vargas received her BS in biology from the University of Texas at El Paso and her MS and PhD in medical and molecular parasitology from the Slacker Institute of Graduate Biochemical Sciences in New York University. During her doctoral training, Dr. Vargas studied proteins involved in post-transcriptional and post-translational regulation of the parasitic amoeba, Entamoeba
histolytica.
Histolytica. Dr. Paloma, please interrupt me anytime I mess up any of these terms. In 2013, she completed her research postdoc as an IRA-CDA fellow at Northwestern University in Chicago, where she studied the role of Legionella pneumophilia's LPN type 2 secretion system in anemic infection. Dr. Vargas currently serves as the Assistant Professor of Biology and the Director of Hispanic Serving Institute HSI initiatives at California Lutheran University. She runs a small research lab studying infectious disease and host pathogen interactions using molecular and biochemical techniques. Courses taught by Dr. Vargas include Introduction to Biology, Introduction to Biological Experimentation, and Emerging Infectious Diseases. As Director of HSI initiatives, Dr. Vargas's work at Cal Lutheran focuses on being a liaison between all departments and divisions at Cal Lu on issues of justice, equity, and access to higher education for traditionally underrepresented groups, including Latinx, Black, Pacific Islanders, and Native Americans. As such, her research interests also include access to higher ed for minoritized populations and the impact of co-curricular experiences on BIPOC in higher education. So with that introduction, I will turn it over to you, Dr. Vargas.
Thank you, Stephen. That is a lot of information. I apologize for the extra long bio. I should have cut that down a bit. So thank you all for joining. Stephen mentioned that I graduated from the University of Texas at El Paso, in El Paso, Texas, and that's where I currently am right now. My parents still live here in El Paso, and after about 3 weeks of social distancing and ensuring that I did not have COVID or presenting any symptoms and was not a carrier, I decided to drive down to Texas with my dog. And so I'm coming to you from the great state of Texas. And from the great city of El Paso. I went through this presentation with my own parents, who are neither one of them is a scientist. So I'm hoping to be able to break some stuff down for you as we learn about COVID and all of the different things that are changing on an everyday basis. Please feel free to ask a question. I'm going to be checking the chat room or the chat box regularly. So if at some point you have a question, feel free to go ahead and send a little message there. If you're not sure how that works, I think there might also be a function for you to raise your hand. I'm going to try to make sure that I keep an eye on that as well, just to ensure that if you do have a question, I can answer that for you as quickly as possible. So the title of my talk today is Life in the Times of COVID-19, Protecting Yourself and Others. Now, this is I'm going to give a brief introduction about the virus itself, give you a little bit more information, hopefully not scare you too much, but instead give you some information on how to protect yourself, your family, your loved ones, and your community around you. So if we can go ahead and click onto that next slide. Now, what is COVID-19? COVID-19 is actually the name of the disease that we get. And COVID-19 or coronavirus disease is the name of the disease that is caused by novel coronavirus SARS-CoV-2. Now, the name SARS, you've probably heard that before, and there's a reason for that. COVID-19 or SARS-CoV-2 is actually part of the same family as the virus we've heard of in the past. The name corona or the family of coronaviruses, this is actually due to, or that name comes from the image that you see on the right of your screen. You look at the right of your screen, this is what an actual coronavirus looks like. You've all seen that really scary picture that is all over the internet. I think it's on the Cal Lutheran website as well, where there's a gray looking structure and like these red knobs sticking out of it. In this picture, it's actually the same thing. It just looks a little less scary, I've been told. And these little projections that you see at the top, these are actually proteins, and that's where the term coronavirus comes from. It looks like a corona, which in Spanish or in Latin is a crown. So corona, coronavirus. Now, I mentioned that the actual scientific name of this virus, and not the disease that it causes, is SARS-CoV-2. It's part of the same family as MERS, or Middle Eastern Respiratory Syndrome virus, which caused an outbreak in Saudi Arabia in 2012. It's also the same family as that of severe acute respiratory syndrome virus, or SARS, which caused an outbreak in mainland China in 2003. And it's likely the one that you're the most familiar with. Both of these diseases, actually all three of these diseases, cause a lower respiratory disease. And we're going to go into what that means in a little bit. And both have evolutionary origins in coronaviruses of bats. Now, what's important to understand is that there are many, many, many viruses out there. There are likely more viruses than there are humans on this planet, than there are animals on this planet. There are viruses that infect everything from bacteria all the way to us as humans. And the important thing to remember here is that they all are related to each other in some way. So coronaviruses exist in other mammals. So they exist in us, they exist in bats. And if we go to the next slide, we'll actually talk a little bit about where these guys may have come from. So where did this pandemic start? What we know is that the origin of the pandemic is in Hubei, Wuhan province, China. Where did this actually come from? And we'll actually go to the link there, Stephen, to show you a little bit of a map of what disease tracking actually looks like here. And what this map actually shows is, if you go ahead and click play there, Stephen, is the origin of this pandemic. What you see is the beginning here in Wuhan and the virus spreading. Now, the important colors to look for are the yellow, which is over 2,000 infections, and the blue, which is actually new infections. Now, if we drag the map a little bit over to the right, what you see is the US lighting up like a Christmas tree. Now, this is important for us to think about as we think about how quickly this disease is spread. Now, all of these different links that I'm going to be showing you today, they're all going to be available to you. I'll provide a list to the folks over in Alumni so that you can go through and click on them yourselves if you like. But what you actually see here is how quickly this has spread. The timeline at the bottom, which is a little bit hard to see, is actually a live action timeline. What you see at the very end of this video is actually data from yesterday at 8 p.m. Eastern Standard Time, which is the last time that this map was updated. Now, this moved very, very quickly, and what we know about this virus will kind of help explain that. So I'm going to ask you to keep this in mind and kind of replay it a little bit over in your head as we continue through the talk. I'm going to ask you at various points to go ahead and just keep some stuff in mind so that you're able to go through and kind of assess what questions you may have. So if we go back to the slideshow, What we know about coronavirus is that coronavirus, in fact, there is evidence that this started off in bats. So I mentioned bats earlier, and bats are going to be a very important part of this information. What you see here is that we see that coronavirus likely started in bats and then moved on to what we think may have been a pangolin. If you don't know what a pangolin is, don't worry, I didn't know what it was either. And apparently it's something very similar to an anteater or an armadillo. And we actually see that the virus, or what we think is that the virus mutated and was able to jump from that bat into that pangolin. Now, a second mutation event allowed it to jump into humans. Now, this is a really important factor to consider and an important piece to remember. Now, the virus can change. This isn't uncommon for viruses. Viruses change all the time. They're very unstable. So their role in the genetic piece of life is to continue to change on a regular basis so that they can continue to live in their host, or you, myself. What you see in the graph on the right is actually information from China itself, from Wuhan. And I want you to take note of a couple of different things, right? The timeline starts January 19th. However, there were cases that have been reported as early as October. Now, this means that those folks were traveling around the world, that virus was adapting and was able to be transferred over. What I remember about October and November is that I traveled a whole lot for work purposes and for some fun stuff. I went to Disneyland, but I was in contact with a lot of different people, and I don't know where those people were before, where they had traveled to, or where they had been. And I think the most important thing to consider in this graph is the black line, which is the cumulative number of deaths. Now, before April, what the information that was provided was that the deaths started to slow down. What we now know as of last week, in fact, is that the number of deaths wasn't actually being reported accurately. Now, this doesn't mean that the government in China was being shady. It's that they literally were having so many deaths that it was hard to take into account and keep track of who all was passing away. Now, keep this in mind, and we're going to talk about this in the context of social distancing, which will come up in a few slides. If we can go on to the next slide, Stephen. Now, how is SARS-CoV-2 similar or different to other viruses? The bottom line is that this is so new that we don't really know. We have changes happening daily. Even from this morning, I was changing this presentation before I sent it to Stephen to ensure that the information was accurate, because that is how quickly the information is changing. What we do know is that within the first 3 months of this outbreak, only about 100,000 people that we know of were infected. Now, again, the reporting could have been a little bit wacky there, but in the 3-month period after that initial 3 months, 100,000 people were infected in just 12 days, right? 100,000 people, 3 months. The following 100,000 people happened in 12 days. This indicates to me as a microbiologist that the virus was or is changing and is becoming more adaptable to the environment that it's in. In other words, it's becoming more adapted to humans. We can go on to that next slide. Now, something that's important for you to consider is how this virus is transmitted. Now, you've probably heard a lot of different things about how this virus is transmitted. COVID-19 is transmitted person to person. It can survive on surfaces anywhere from several hours to a few days. And virus particles can survive in the air for up to 3 hours and can spread up to 6 feet away, which is why we have social distancing of at least 6 feet. And the virus particles can hang in the air. They don't hang out by themselves. They actually hang out in a cloud of moisture, and we're going to talk about that in a second. Now, why are we being asked to socially distance? We're going to go into this in greater depth in a minute. But part of what we always look at as scientists is how many people can one person infect? Now, on the top right hand of your screen, what you see is the number of people that one person can infect on average. This is what we call the R naught. And for things like Ebola and HIV, it goes somewhere between 2 and 4 people. So one person can infect up to 4 others. And that's really important to think about as we move forward with trying to determine a timeline of when we can go back to our new normal. It's not as contagious as something, for example, as the measles or the mumps, but it is pretty contagious, right? Think about that. An average size family is 4 individuals. That means that only one person can infect the entire family. Now, if we go ahead and click on that video, you'll actually see how and why that 6 feet of distance is important.
Are you sick? Don't you dare sneeze on me. Do you know how far your germs can travel? Normally you hold about half a liter of fluid in your lungs. So when you sneeze, you're able to spray as much as a water bottle's worth of mucus into the air around you. It shoots out of your mouth in the form of moist, germ-infested clouds, traveling up to 35 meters per second. That's fast enough to give you a speeding ticket on the highway. Once that cloud hits the air, it expands, breaking up into snotty strings, then a series of different-sized droplets, all trapped in a turbulent gas cloud. One brave group at MIT discovered that the biggest droplets can travel up to 2 meters, about the distance between your desk and 2 desks away. But most other droplets? Those travel much farther, up to 8 meters. That's about 5 desks away. Not only that, the germ-infested gas cloud is less dense than the air around it, so it rises upwards, right to where ventilation systems and other people's unsuspecting noses and mouths await. Even though these are relatively smaller droplets, they're probably still teeming with harmful pathogens like the flu virus. Even worse, depending on the ventilation, they can spread through a room in just a few seconds and remain suspended for up to 10 minutes. Now, if you happen to notice someone around you sneeze or cough, you can hold your breath as you move out of range. But during the flu season, that might not even be enough, because there are danger zones everywhere, especially on surfaces like desks, doorknobs, and steel handrails. It turns out, the flu virus has been found to survive for 24 hours on a steel surface. And if you touch that surface and don't wash your hands before eating, you may have just gotten infected. So let's say you go into work sick with the flu one day, and you start to sneeze. Now, according to one study, you'll probably only infect 1 to 2 other people. You're clearly showing symptoms of the flu. However, it's going to take a few days for symptoms to show up in other people you've infected. So those poor souls unknowingly also come into work sick over the next few days. And they will potentially infect 1 to 2 more people. In an office of 100 desks, this could mean 10 or 15 sick people by the end of 2 weeks. That's over 10% of the office. And all of it started with just one sick person. You. All thanks to the germ-laden cloud you so generous.
Right, so you get the idea that while we're using the example of the flu, this is the same method of transmission that happens with COVID. And so one person could then, in this case, they showed one person infecting 2 people, but now imagine this infecting up to 4 and how quickly that can spread. That would mean, you know, about 30% of the office being infected. And we can go ahead on, go on to the next slide. Now, I've included a lot of videos in here for you just to get some visuals. Now, once the virus is out in the open and perhaps getting into your body, what actually happens? And go ahead and click on that video and we'll review a little bit of the biology.
So let's say that this guy has the flu, could be any flu, and here's a droplet from his sneeze containing, if we move in and take a really close look, you see each one of those little purple things is a virus. And there are a lot of viruses floating through the air, some of which go inevitably up this unfortunate man's nose.
How did that guy feel when you ripped off half of his face?
It was interesting because we did it while he was sleeping.
Okay. I am talking with medical illustrator David Belinsky, who designed this video for Xyrus, a research company. So here comes the virus, and it's going to land on one of this guy's throat cells. So notice it's covered with little yellow knobby things. You call these keys, right?
Those are the keys.
Yeah, this is a key, this is a key, this is a key.
Okay, if the keys on this virus happen to fit the locks, which are those little purpley stick-uppy things on the surface of the cell, if there is a match, the cell, watch this, welcomes the virus in. And what's this?
This is the welcoming committee. They all interlock with each other, and they pull this membrane down into the cell.
And down it goes deeper and deeper, and that welcoming structure disperses, and the virus capsule bursts, and out comes the secret recipe for how to make more viruses in those little noodly things. So this unsuspecting cell has been tricked into guiding these virus recipes right into its own command center, the nucleus. So in they go.
And they are immediately recognized by this big pink molecule, which is a mini factory.
Yeah, what is it doing?
It threads the nuclear material, the instruction code of the virus, through one hole, and out another hole comes a brand new instruction set.
So it's a copying machine making copy after copy after copy of virus recipes, which then go out of the nucleus to little chefs, those blue peanutty things. They cook up proteins that go back into the nucleus where they are reassembled into baby viruses, and then out they go. They get covered up and head to the surface where they get new keys, and then boom, here they come. This is an eruption of virus after virus after virus after only one virus entered the cell. But how many came out? Well, millions. Millions. So if one virus can produce a million babies again and again and again, how come?
So as you can see, it's not that the virus can just enter any cell at any point in time. There has to be a lock and key mechanism. And for COVID, we actually know what that lock and what that key is, which as we'll move forward, keep that in mind as part of what we're developing in the science community for therapeutics or for vaccines or preventative medication. Let's go ahead and go on to the next slide. So now you know where this guy came from, you know how it infects your cells, you know the timeline of what this pandemic has looked like, and now really it's talking about symptoms and diseases. Now, symptoms, if you get them, will show up within a range of 2 to 10 days. That average symptom showing timeline is about 5 days. However, you can also be infected without exhibiting symptoms. About 15 to almost 45% of infected patients do not develop disease. That means that they are carrying the virus, and we can actually be transmitting the virus to others without even knowing that we are infected. This is something really important to think about as we move on to the next slide. The major symptoms that you're gonna get if you do get COVID and you do develop symptoms are gonna be things like cough, shortness of breath, and fever. These are very similar to what you would feel with the flu, but they're gonna be a little bit more intense. If you have advanced disease, you can develop conjunctivitis or infection of the eyes, pneumonia, diarrhea has also been associated, and some of the less common disease symptoms that you might develop would be a loss of the sense of smell. Now, there may be 2 reasons for this. It could be that as the virus goes into your respiratory system, it is actually blocking those lock and key mechanisms for different particles that actually activate your sense of smell. That's the best case scenario. The worst case scenario is that the virus is actually attacking the olfactory nerve and damaging it so that you may not be able to smell. Let's go on to the next slide. Now, one of the things that we've been hearing over and over and over, including these symptoms, is that we shouldn't touch our face. And I don't know if you've noticed, but I haven't touched my face the entire video. I'm actually hovering right above my face. One of the things that we are asked to do on a regular basis is to wash our hands. And this is going to be a really, really important thing for you to consider and for you to continue to do as we continue to socially distance and stay at home. And this video, which Stephen will click for me, is going to tell you why.
This is what a virus, like coronavirus, looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses and their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer hurts too because it's mostly alcohol. And
we'll talk about hand sanitizer in the question and answer portion. But as you can see, soap is really important here, and washing your hands for those 20 seconds plus is also really important. Now, this is a change for all of us, right? We're all really, we move through life very quickly, and I can't remember the last time that I stood there and counted until 20 seconds and washed my hands prior to our coronavirus pandemic. I do wash my hands regularly. I probably wash my hands more than most people because I'm in the lab, but you know, being conscious of when we're going to be washing our hands and how often we wash our hands is really important. If we move on to the next slide, we're going to start talking about how why we're socially distancing and how this is actually protecting you. Now, I've had a lot of questions from a lot of people on Instagram and other social media platforms of why are we socially distancing? Why can't we just be with each other? And why are we socially distancing together? Now, this and other viruses, as I mentioned before, can survive on surfaces for a while. If we're all going out to the same place and touching all of those same surfaces, we're going to be transmitting virus to each other. We showed you the video where your sneeze can actually travel 6 feet up to 24 feet, right? If that's 8 meters. And social distancing helps us flatten that curve, or that rate of transmission. If we're not in contact with other people, it is going to be very, very unlikely that we're going to transmit disease to others. Think of that R0 that we talked about in the second slide, where we said from one person, up to 4 others can be infected. If we're not socializing with others outside of our homes, we're going to limit that to a very small number of folks that we could potentially get sick. Now, social distancing is really important for all of us, but it specifically protects the most vulnerable among us, the elderly, babies or infants, and those that are immunosuppressed. Now, I've shared with the campus community that my mom has cancer, and that's something that I'm very conscientious about. She goes to chemotherapy. Those folks that have diabetes or have renal disease or cardiovascular issues, those are the folks that are going to be the most at risk. So really, while you're protecting yourself, the people that you're really protecting the most are the loved ones that you have either near you or in your community that you're going to help prevent this virus from getting to. This virus, as with any disease in those that are immunosuppressed or that have immunodeficiencies, those viruses can affect those individuals at a much stronger rate. They're going to develop way more severe symptoms, and we want to prevent that from happening. As good neighbors, we are a Lutheran institution, so as good Lutherans, we want to make sure that we protect those around us, protect the people that we love, and prevent from spreading this disease. And the longer we do this, the better. Look, I get it. I don't want to be stuck at home all day either, but this is for your own good and the good of others. Go ahead and move on to that next slide. The Department of Public Health in Ohio actually set out a really cool and very short clip for you to understand a little bit better why social distancing is important. And what you see in this video is that a ping pong ball is dropped on a slew of mouse traps that are very close together. Stephen, go ahead and click on that and we'll see what happens. So what we see in this video is that these traps are all very close together. Now think about this at a celebration, right? Maybe something like commencement or ScanFest that we all enjoy so much, or any other gathering. If we're all that close together and there's at least one person that gets infected, or maybe there's 2 or 3 or 4, think about that R0 that we talked about. That handful of individuals that may not know they're infected, may not know and are not doing this out of any malice, are going out to enjoy themselves as well, but maybe they're not presenting symptoms, but they're still transmitting disease. That is a huge issue, and that is why we need to stay separated from each other. Let's go ahead and go to that next slide. Now, how do you protect yourself and others that you love, or others that you don't love, just other folks in the community? You want to stay home unless you have to go to the doctor or you yourself are a healthcare provider. Obviously, going to the grocery store is important as well, but try to limit those trips. Make one trip instead of a trip every day, or once a week versus every day of the week, once a month if possible. And you want to do the following. You want to wash your hands with soap on a regular basis for 20 seconds or more. You want to clean high-touch surfaces. This is the biggest culprit. I don't think you can see it because I have a virtual screen on, but this is my phone, and this is the biggest, that's my dog Riley. This is the biggest culprit of a high-touch surface. I don't think I've ever cleaned my phone this much in my entire life as I have over the last few weeks or months. Make sure you wipe those down. You can use a disinfectant wipe, or you can make your own 10% bleach solution at home. Just be careful not to bleach any of your clothes or your cloth materials. What you need to know is that you do not need to wipe down your produce. That actually messes up your produce, and there has been no evidence that this is a way to transmit the virus. I generally suggest tossing out takeout containers in case somebody that was infected was handling the container itself. If somebody that was infected was making your food, you need not worry. It's not transmitted through the oral route. Let's go ahead and go to the next slide. Now, other things that have been coming up is how to protect yourself and others using personal protective equipment. Now, personal protective equipment is really important. I was going to try to get some gloves for you, but they are on short supply and demand is high for them, so I don't want to be wasting materials, but we will talk about that in a second. You can develop your own face covering using something like a simple bandana. I have one from an optometrist, I think, that gave them to me. Or actually, this is the Fred Hutchinson Research Center up in Washington. And there are videos online for you to be able to make a no stitch or no sewing mask. I'll share some of those with Steven for him to upload for you, and you can make your own mask at home. Now, the mask is not meant to protect you specifically. It's meant to protect others from you. So if you are infected and don't know it, this actually will block those droplets that we talked about in that first video from getting to other folks. It'll actually block those particles from exiting through a bandana or something of the sort for them to get to other people. Now, with gloves, it's really important that you follow the following guidelines, right? Wash your hands before you put on gloves and dry them with a paper towel. When you're putting on gloves, it's pretty easy to put them on, pretty straightforward, but the biggest mistake that I see folks doing is in taking them off. Now, I'm going to try to demonstrate without actually wearing a glove, but what you will do is you actually pinch the bottom or the opening of the glove and you peel it off like you're peeling a banana, right? That'll leave the glove in one hand. Your other hand is free. Leave this hand behind your back, okay, for now. Now, what you're going to do is you're going to bring that second hand back and you're going to do the same thing. You're going to grab the very edge of the glove at the bottom and you're going to peel it up like a banana. Now, that's going to leave you a little glove sack that's going to have both gloves in there. You haven't touched the outside of the glove, which is the most important piece. And the most important thing for you to do is throw this in a trash can. Do not leave it on the floor. Do not leave it in the parking lot. Do not leave it with your friend. Do not leave it with your neighbor. This is like a Dr. Seuss thing. But make sure you toss this away because you've potentially touched virus. And now the folks that work at the grocery store, the folks that work at the gas station are picking up after you. And we want to make sure we protect them. So let's go ahead and go on to the next slide. Some do's and don'ts. Do wash your face covering regularly. It can become contaminated. Learn how to properly put it on and take it off. You always just want to grab it by the little straps or the little hair ties if you make your own. You don't want to be touching your face at all. You want to wash your hands before you put on your face covering and immediately after you take it off. What you should not do not use N95 or surgical masks. These are in short supply and folks that are doing the hard work at hospitals and clinics need those. Don't adjust the mask and touch your face while you are wearing it. And I think most importantly, don't fall into a false sense of security thinking that you are safe forever because you are wearing a mask. You can still become infected by touching your face. So again, if you notice, I'm going to turn sideways. I am not touching my face at all. I'm hovering right above my face. If I have an itch or if I have, as a person that's worked in a lab for a really long time, I'm used to not touching my face. I wear glasses. My glasses often slide down. If you're in that position, use your bicep. Push up your glasses with your bicep. If you need to sneeze, sneeze into your elbow. Avoid your hands. Let's go on to that next slide. All right. Just some stats for you as we're starting to wrap this up. Worldwide, we have 2.6 million test confirmed cases. Now, this is an important number to think about. These are just cases that have been confirmed through testing. That doesn't mean it covers all of the cases that are out there. In fact, I would say that there's probably 4 times as many people that have been infected. 183,000 deaths, 710 recoveries. In the US, something really important, we have about a third-ish or a little bit more of the cases, 841,556 confirmed. But what we also know is that the US is not testing at the levels that we need to be testing. 46,000 deaths, over 46,000 deaths, 78,000 recovered. And I think something that's really important for all of us here on this call is that the death rate can range depending on the country. In the US, it's about 7%, but overall is between 2 and 14%, with those that are most affected being 65 years of age or older. The death rates for individuals that are 65 to 84 are between 3 and 11%. And for those that are 85 or older, 10 to 27%. And then really importantly for you to know is that the death rate among communities of color, Black and Latinx individuals, is 60%. Now, this is not because the virus is racist or because the virus targets any ethnic or racial group specifically, but because these communities, including tribal communities as well, have limited access to healthcare, and this is part of a systemic racism within the healthcare industry. So something really important for you to note. If you are a person within a community of color, make sure that you are checking yourself regularly. Something that I will say for those of you that are on the call is that if you do start experiencing symptoms, a very simple thing that you can do is order on Amazon or any other website a pulse oximeter. They're about $30 to $40. Now, one of the things that COVID causes is shortness of breath. The pulse oximeter is actually measuring how much oxygen you have in your body. If that number, if you're experiencing symptoms and that number drops below 80%, that is the time for you to go to urgent care or to the hospital and tell them that you're experiencing symptoms. This could be a life-saving moment for you. So keep that in mind, and I will share that information as well. Let's go on to the next slide. Right? Testing, treatments, and cures. Testing is now available on demand in LA County. However, in Ventura County, they're only doing this for critical need. This will only tell you if you have an active case of COVID-19, not if you have had it before. There is no vaccine or cure, but there are vaccines in development. And there is no treatment. This is all focused on symptom management, making sure that as your immune system starts to fight off the infection, that there are things that are going to be given to you that allow the immune system to not kill you. We're going to go on to the next slide and give you some information. So why is going back to normal hard to do? Well, remember that I said we predict that for every person that tests positive, there may be an additional 4 cases. So that 2 million number could actually be 4 times that. And we talked about social distancing. Social distancing is helping us tremendously because it is keeping us apart and preventing that mousetrap scenario. Now, what you see here in this graph is actually Spain. These are actual real numbers from Spain. And as you can see, in the middle of April, late March, Spain thought they had hit their peak. Now, these numbers have since gone up. They started releasing people to go back to work, releasing or relaxing those social distance guidelines, and now those numbers are coming back up. And these are just numbers that we know of, let alone the people that have not been tested. Now, the final slide here, I think, is going to give you some information about drugs that are in the pipeline. All these drugs are within processing and development. There's actually only one drug that has been previously used for a different disease that may be showing some promise in being able to deal with COVID. Something important for you to know is that remdesivir and other antivirals are really only useful within the first couple of days of infection. Is very similar to Tamiflu, right? If you've had the flu for a week, Tamiflu isn't going to help you. But what might help you are things like anti-inflammatory drugs. The biggest issue with any one of these viral diseases is not so much the virus, is that your immune system starts attacking everything and starts creating what we call a cytokine storm. And it is exactly what it sounds like. It's a storm of immune cells coming in and trying to destroy this virus. And in that process, they end up destroying you as well. So we want to be able to manage those symptoms, but there does seem to be some promise in different therapeutics that are coming out. We've seen plasma transfusions in the last few days that have been helpful to those that are in the most dire need. But it'll be a while before we get a vaccine that is going to be fully helpful and fully protective. Vaccines usually take 7 to 10 years to develop, and we're trying to develop one within an 18-month period. So just keep that in mind. That is all the information that I want to present to you today. The sources are listed here, and I can make that available as a Google Doc or as a Word document to share out. If there are any questions, I'm happy to take those questions now and provide any additional information you may want to know.
Great. Thank you, Dr. Vargas. That was truly a very informative, great overlook of COVID-19, and I hope everyone on the call found that really, really useful. I know I did. So just a reminder that there's a chat feature on Zoom if you have any questions. I'm seeing a couple come through, so I will field those for you, Dr. Vargas. So a question about grocery shopping and veggies. I know you said we don't have to wipe down produce, but should we, still be washing them as normal? What's the procedure for processing groceries? I guess.
Yeah, definitely. Wash them as normal. You don't have to wash them before you store them. Just wash them before you use them. That's more for your own health and safety with any sort of bacteria or other viruses that might be on there. But there's no evidence that corona is transmitted through touching produce in any way.
Great. So a similar question along those same lines. I know there's surely been a huge uptick in online shopping, a lot of deliveries coming to people's homes. Kind of in the same vein, what's your recommendations for kind of processing, sanitizing, throwing away delivery,
Sure.
cardboard and stuff before we bring it into our houses?
So I've seen people do all sorts of things. Personally, what I do is I will open the box outside just so that I'm not bringing it into my home. I mentioned that my mother is immunosuppressed, so I take an extra caution. So I'll open the box up outside. I'll take a little wipe and wipe down any surfaces that might be on the smaller package that is inside of the larger box. The larger box can be recycled. The virus won't survive very long in heat now that we're warming up a little bit more. And I'll take the smaller package, wipe it down. And the most important thing here is not really the packaging itself, it is your hands. So make sure that as soon as you wipe that packaging down and throw away that box without touching your face, you go over to your sink and wash your hands with soap and water for about 20 seconds.
Great, thank you. And then one more question that's come through. In your opinion, do you think it's possible for a vaccine to be developed in that 18-month time period?
I think it's possible. I don't think it's going to be a very strong vaccine. I think it'll be a vaccine that we will have to revisit and continue to redevelop so that it protects, has what we call high coverage. We want vaccines to be able to, if we give a vaccine, we want 90% of those individuals that were vaccinated to be completely protected. When we try to rush things as we are now, vaccines tend to have a lower coverage rate. That doesn't mean they don't work. It just means that you may have to get a booster, you may have to get a second vaccine. And so to avoid that process, we want to develop a vaccine that is going to be a little bit higher coverage, and it'll take longer than that. But I think a good first step will be that initial vaccine that we develop within an 18, at most 24-month period.
Great, thank you for those insights. So that's all the questions that have come through the chat, and we're just about at time. So all the other comments are really just thanking you, Dr. Vargas. So I will echo those thank yous, and a huge thank you for your time and sharing your expertise and insights with us this morning. A truly valuable and informative webinar. So thank you for sharing your time with us this morning. Thank you to everyone on the call for joining us. I hope you found that time valuable as well. Just a quick plug for our next webinar next week. Dr. Jean Sandlin, one of our communication professors, will be presenting on the value of storytelling during these difficult times, a really great webinar for families. So I hope you'll be able to join us next week on April 30th. So again, a huge thank you to Dr. Vargas. Thank you all for joining us on the call. I hope you all continue to stay healthy, take care of each other, and stay safe.
Bye all. Thank you again.